The World Health Organization is probing the origins of the coronavirus pandemic. This week, investigators arrived in Wuhan, China. On Monday, the Chinese government provided them with access to 2 Wuhan disease control centers. The WHO has visited hospitals and a seafood market looking for clues. China's government is known to have strict control over information related to the virus. It has also sought to avoid any blame for potential missteps early on in the outbreak. A new PBS Frontline documentary called China's COVID Secrets explores the 54 days from the first known symptomatic case in Wuhan to the city's first lockdown. It also dives into the extraordinary steps Chinese officials took to keep the rest of the world in the dark. Here's a preview.
Doctors were now dealing with more and more people turning up sick in Wuhan's hospitals. Health workers have been forbidden from talking to the international media without authorization, but one agreed to speak. This is the first time a health worker from Wuhan Central Hospital has talked to international journalists about what was happening in those early days of the outbreak. We are protecting the person's identity and using an actor's voice.
I began to suspect there was human-to-human transmission around the 5th or 7th January. There were so many people who had a fever. The respiratory department became full around the 9th or 10th January. I realized this thing had become big. It was out of control. Then we started to panic.
But on state television, a representative of the government team investigating the outbreak maintained it was a viral pneumonia.
Joining me now from London is the filmmaker behind China's COVID Secrets, Jane McMullen. Well, Jane, let's rewind a little. Your documentary explains that when it comes to transparency, China's protocol for handling the coronavirus pandemic actually started with a previous outbreak. Tell us more about that.
So we believe very strongly that the film should start with SARS, which was an outbreak of a coronavirus that took place in November 2002. It went into the following year, early 2003, and cases were beginning to really sort of mount up in southern China, spreading through these sort of large factory cities of Guangdong province in southern China. And it was months before the government took decisive action, acknowledged the scale of the outbreak, acknowledged the number of cases. And in those critical months, SARS spread around the world. It would ultimately cause just under 800 deaths worldwide. What SARS did, it caused huge travel, trade, economic disruption in China, but it also shook the political system in China because it caused anger within the country. There was anger especially in southern China, that people didn't know what was happening. And there was also international criticism of China that China wasn't being open and upfront with the world about what was happening. And so these two things meant that SARS kind of triggered this real soul-searching that led to the establishment of a brand new infrastructure for infectious diseases. And they created this online reporting system, which they claim was the largest online system in the world. And in 2019, the head of the China Center for Disease Control, George Gao, was able to tell audiences that he would know within hours of any outbreak anywhere in China, that it was literally a process of a click of a button, and a doctor could report a new infectious disease and it would go straight to Beijing. And what's extraordinary is to sort of understand this context, because then obviously it doesn't go to plan, it doesn't go according to plan. And also it's very interesting to sort of look at these parallels, places where it is similar to SARS, the coronavirus outbreak is similar to SARS, and places where it maybe isn't so similar.
And Jane, on that point, why didn't the Chinese government learn its lesson after SARS? And what was the guiding principle around the decision-making when it came to COVID-19?
It's a well, obviously that's the central question, and it's not there's no straightforward answer to this question, because one of the things that the documentary shows, the documentary tells this story in a very granular way through these days, these crucial 54 days at the beginning of the outbreak. And what we see over these days is what one of the people in the film calls, he says, it is possible that there is a systemic failure. There's a sort of catalogue of failures through the political system, through the various levels of the bureaucracy. So you've got doctors, you've got scientists who start to suspect there's something happening, and they are, for whatever reason, they are silenced in succession. You've got we're looking at pictures of the local and the provincial governments there meeting in Wuhan at the time that this was unfolding. And so there is evidence, and we reflected in the program, that these politicians didn't want anything to sort of disrupt this very important annual meeting that was happening in Wuhan. And then, of course, you've got the national government and the different parts of the national government who have a tremendous, sort of urge to keep stability, to keep the political system stable, to make sure that people are not, in this time, you've got Chinese New Year, you've got these big political meetings happening in Beijing, and they feel this great importance to keep everything smooth during this time, everything stable during this time.
Right. It's such an important point, and I think here it's worth just noting that, as you point out in the documentary, this is really about the Chinese government, because they were, in essence, keeping their own people in the dark as well, as you spell out over the course of this. So the Chinese government, as we know, has this tight control over information. Can you tell us, Jane, what was the experience like getting these interviews and other resources you needed to research and try and get the facts amid a lack of transparency for this documentary?
Let me start by saying that we started the process of trying to understand what happened, starting to research this very soon after the lockdown of Wuhan. So this was back in the very early part of 2020, before it became a pandemic. And at that point, obviously, it was a story that really was extremely interesting from the perspective of the Chinese political system, but it wasn't at that point a pandemic that was affecting all of our lives. At that point, there was a measure of openness within China. So there was a really extraordinary sort of flourishing of the Chinese independent media. There were lots of reports coming out of these extraordinary publications highlighting missteps, trying to tell the story of the early time. Now, as the story has become bigger around the world, as the rest of the world has been more and more impacted by the pandemic, China's actually felt, it appears that it's felt less inclined to give space to those voices that highlight the sort of delays and missteps. So that sort of space to do this kind of reporting has got smaller as time has gone on. So of course it has been, hugely challenging. But as I said before, there are people who do believe that this is an important story, that the world needs to know, that China needs to learn the right lessons, that the world needs to learn the right lessons from this.
Absolutely. Well, the new Frontline documentary is called China's COVID Secrets. Jane McMullen. Jane, thank you very much.
Thank you.